Mwangi with yet another episode of Interpreting 101. Today I'm going to be talking about accessibility in the healthcare services. This is something that deaf people are struggling with in 2020 in our country, a country that has trained interpreters, a country that has interpreting agencies that are coming up, Accesibility being one of them. Why are we struggling to ensure that deaf people are accessing healthcare services? So what happens in Kenya, the burden of accessing healthcare services for a deaf person is upon them. Why? Because they have an extra need to always have an interpreter when they want to see a doctor. Why should that be the case? Healthcare facilities should be able to provide interpreters whenever a deaf person shows up. They should not let the burden be carried by the deaf person. That should not be the case. So our government, you're failing us. Our private hospitals, you're failing the deaf community. Now, in most developed countries, this is what happens. For government facilities, the government contracts an interpreting agency that is always going to be on call whenever a deaf person shows up in a hospital, whether it is an appointment or an emergency situation, or even a delivery. Someone is delivering a baby. At whatever time of the day or night, the interpreters are always on call as long as the agency is contracted by the government. This should be the case in our country, especially with the advancement of technology, where we can have virtual meetings. As interpreters, we provide virtual interpretation in meetings. We have done that since COVID started because people can no longer have physical meetings. With that in mind, why would we be having deaf people struggling to access healthcare? That should never be the case. To the Ministry of Health, to all public hospitals, it is time you step up. Deaf mothers have struggled for a long time. They're never given the chance to make their own decisions when it comes to their babies. Why? Because there's a communication barrier. There's always a communication barrier. And if a deaf mother shows up in a hospital without their own interpreter, decisions end up being made for them. They're not given the choice to decide what they want with their child. If nobody makes that decision for you and me, no one should make that decision for the deaf mothers. Emergency situations, the government needs to have plans to always have interpreters on call. Allow deaf mothers to make their decisions, because most deliveries happen as emergencies. You never know when the baby is coming. And sometimes we can plan, but things don't go according to plan. So always have an interpreter on call in case a deaf mother shows up and they need the services. Government hospitals, do something about this. Ensure healthcare is accessible to deaf Kenyans. If it is accessible to the rest of us, it should be accessible to them. Thank you for watching. Keep it here. If you need the services provided for you, if this video has made you think and realize, well, I should be doing this, you can get in touch with us at Accesibility on info@accesibility.co.ke. Our website is www.accesibility.co.ke. Do not leave here before subscribing to our YouTube channel for more tips on how to ensure accessibility of services. Thank you for watching.